Fenugreek gets sold like one seed can do three different jobs: lower blood sugar, increase breast milk, and raise testosterone. Before we chase all three, is this really the same thing as adding a pinch to dinner?
No. The first useful move is sorting exposure. Fenugreek as a spice is flavor plus a little plant chemistry. Fenugreek, as studied for metabolism, is often seed powder, defatted seed flakes, or extract taken daily. That changes the dose of soluble galactomannan fiber and other compounds, so the evidence cannot be copied straight from a capsule label to a curry recipe. Mechanistically, the most grounded story starts in the intestine. Fenugreek seeds contain galactomannans, a soluble, viscous, fermentable fiber. When enough of that reaches a meal, it can slow carbohydrate access to digestive enzymes and glucose absorption. That is a plausible reason glucose markers move more than, say, dramatic body weight outcomes.
So, if someone with type 2 diabetes sees fenugreek called a blood sugar spice, what is the fairest version of that claim? Are we talking about tiny fasting changes, smoother post-meal curves, or replacing medication?
The cleanest recent example used continuous glucose monitoring in adults with type 2 diabetes. Participants ate controlled diets with and without 30 grams per day of defatted fenugreek seed flakes. In the per-protocol group, the fenugreek period reduced 24-hour glucose area under the curve in glycemic excursions over 2 weeks. Helpful signal, but small study, short duration, and a specific food product.
One small CGM study is interesting, but people are buying tubs based on certainty. Do reviews show a pattern, or are we cherry-picking one unusually positive trial?
The pattern is real enough to respect, not strong enough to oversell. A 2026 systematic review of plant galactomannans included 20 fenugreek trials and found fenugreek preparations consistently improved glycemic outcomes, while body weight effects were less consistent. Another flour-based food review also placed fenugreek powder among foods, improving glucose homeostasis. That points to metabolic support, especially when baseline glucose is abnormal. That same glucose signal creates the main caution. If someone uses insulin, sulfonylureas, or several glucose-lowering medications, adding a concentrated fenugreek product could push numbers too low. This is not a reason to panic over a seasoned meal. It is a reason to coordinate supplement use, monitor glucose, and avoid changing prescriptions on your own.
What about lactation? Fenugreek is everywhere in milk supply teas and capsules. If a parent with a preterm baby is pumping and anxious, does the evidence justify trying it?
There is a signal, but it is not definitive. In a 2025 triple-blind trial, mothers of preterm newborns took 500 milligrams 3 times daily from day 5 to day 14 after delivery. Milk volume was higher on day 7, but by day 15 the between-group difference was not statistically significant, and prolactin was not significantly different. So, possible short-term volume effect, not proven durable hormone correction.
Would you tell that parent to just buy it online, or is this one of those moments where the medical context changes the answer?
Medical context changes it. A lactation consultant or clinician should help first, especially with preterm infants, low infant weight gain, maternal diabetes, anticoagulant use, pregnancy soon after delivery, or a history of legume allergy. Fenugreek can cause gastrointestinal symptoms, and supplements can interact with medications or differ from study products. The decision should support feeding, not replace clinical troubleshooting.
Now the men's health aisle. Fenugreek gets framed as a testosterone booster and muscle shortcut. Did the newer randomized trial actually show a meaningful testosterone effect, or mostly a lab nuance?
Mostly nuance. In a 12-week double-blind trial of a specific fenugreek extract with essential nutrients, plasma total testosterone and free testosterone index rose from baseline, but not significantly versus placebo for the main pooled comparison. Saliva testosterone did increase versus placebo, and the highest dose changed free testosterone index, but participants reported no subjective effects. That makes it interesting, not a proven vitality or muscle intervention. If someone still wants a rational trial, match the form to the goal. For glucose, a fiber-rich seed or flake product taken with meals is more biologically aligned than a mysterious hormone capsule. For lactation, use only with clinical support. For testosterone, decide ahead of time what would count as success, because feeling better was not shown in that trial.
So the bottom line is not that fenugreek is fake. It is that the most believable benefit is modest glucose support from enough seed-derived material, especially in people with abnormal glucose. Milk supply has a short-term signal but needs guidance. Testosterone marketing is the shakiest leap because lab changes did not translate into reported benefits.
And pause before concentrated fenugreek if you're pregnant, preparing for surgery, using anticoagulants, managing diabetes with medication, or allergic to related legumes. Stop if you get concerning gastrointestinal symptoms or allergic reactions. Supplements are not pre-approved like drugs, and products online may not match the research version. If the claim sounds universal, the evidence is already being stretched.